Hello and good afternoon. Thank you so much for joining the Bloomberg Fellows Program Adolescent Health webinar. We are so excited to talk to you guys about all of the wonderful things and opportunities that are available here through the Bloomberg American Health Initiative. My name is Shannon Jones. I'm the Communications and Events Manager here with the initiative. And today we are joined by some special guests. We are joined by Mia, who is a recent Bloomberg Fellow graduate. Mia is with the Community Pediatric Programs in New York. We're also joined by Alan Shapiro, who's the Senior Medical Director with Mia's organization. And we're really excited to have Tamar Mendelson with us today, who's our Bloomberg Professor of American Health and Adolescent Health. So thank you guys for joining us. And last but certainly not least, I'm joined by my colleague Shane Bryan, who's our Partnership and Engagement Officer. And Shane will be leading us through the slides, and then we'll turn it over to all of our guests to give their feedback and share their experience with the program and the initiative so far. And before we get started, I just want to go through a few housekeeping notes. This is an audio-only webinar, so we do ask that you mute your devices. Also, there is a Q&A session. We'll have a Q&A session after the presentation, so we welcome you to please feel free to type in your questions if you have any at any time for any of our guests. We welcome you to please ask as many questions as possible. We also have tech support available, so if you have anything going on with your computers, feel free to type that in as well, and tech support will be able to assist. This webinar is recorded. We will share a link on YouTube, and it will also be sent out via the Eventbrite portal, so please be on the lookout for that, and we ask that you share that link with your colleagues and your networks and watch it a few times in case you miss anything. So without further ado, I will go ahead and turn it over to Shane to get started with our content.
All right, Shannon, thank you so much. And thank you all for joining us today. We're looking forward to sharing with you information on the Bloomberg Fellows program, answering your questions, and hopefully looking forward to seeing those applications for the program coming out soon. So let's go ahead and get started. Now, then, the goal here at the Bloomberg American Health Initiative is to improve the health of the United States. And we know we only can do that through partnerships with individuals and communities who are on the ground doing this work across the country. Now, back in 2016, when the initiative first started, we had gotten the report that in 2015, the life expectancy had declined, which was the first time in many years and has done so every year since. And we here at the School of Public Health at Johns Hopkins University and the leaders at the Bloomberg Philanthropies got together and came up with what is now the Bloomberg American Health Initiative. And it's through research, policy, and education, and action-based approach that we believe we can change this trajectory. So we'll talk a little bit more about what it is that we're doing. Now, everything through the Bloomberg American Health Initiative focuses on 5 key areas. We believe these are 5 of the areas that are critical right now in public health and the health of our country. So addiction and overdose, adolescent health, which we'll talk a lot more about today, obesity in the food system, environmental challenges, and violence are all of the 5 focus areas here at the initiative. Now, just to give you a sense, we take a broad approach to the way we view the work that you all are doing in the Bloomberg American Health Initiative. As an example, with environment, we look certainly at climate change and air quality, but also at built environment, how a community's access to public transportation affects that community's health. Thinking about air quality in schools as it relates to students' learning. And so there is, across these 5 focus areas, a very broad approach through us here at the initiative to view your work as it relates to what we are trying to do. So with the 5 focus areas, we also have 3 cross-cutting themes. These themes are important and we keep to the forefront of our work. Equity, evidence, and policy. With equity, we are thinking critically about the partnerships and the areas in which we currently have a fellow and an organization present. We recognize that as a national initiative, we need to ensure that communities across the country, both urban and rural, on the coasts in Middle America and in the Deep South, all have opportunities and interests in becoming a part of this initiative. Also within equity, we're thinking and being mindful about providing opportunities and connecting with folks from a variety of lived experiences. So folks who maybe haven't taken a traditional trajectory towards public health, but are certainly doing that work of public health in their community. We have a really unique opportunity here at the initiative to truly diversify the field of public health by providing the financial support and academic support for individuals to be successful in the field. So we'll talk a little bit more about that in just a couple of moments. So our next theme is evidence, and in public health, we always want to ensure that we are using the best evidence, rich evidence to inform our policies and programs. We want to support organizations in setting up data management systems that allow us for them to collect that rich data and then assist in ensuring that the data can then be turned around to enhance the work that those individuals are doing. We are looking to close the gap between the academics and the work that happens in public sector. So how can we support those types of collaborations? And then within policy, we are most certainly thinking about national, state, and local policies, but also for policies, we think about those policies that within your organization truly affect your ability to work with community, and how can we look at those policies and use the data to inform best practices. So taking a step back, in 2016, the School of Public Health here in Baltimore was celebrating its centennial. And so Mayor Bloomberg, who is an alum of the school, provided a $300 million gift to get this initiative started. That's going to allow for us to bring in 25 endowed professors and support folks to do the work within the practice field. We are fully funding 50 Masters of Public Health degrees annually. We're very excited. We have done that this year, actually. We brought in 50 MPH students in June, and we'll do so in the years moving forward. And funding up to 10 full scholarships for the DRPH program. And so these are just some of the numbers of what the initiative looks like. So our approach really lies within research, education, and practice. It's the way that we do our work. And we know that you all on the line would probably love to hear about our research initiatives and the great work that our faculty are doing in the practice realm, but we're really here to talk about the Bloomberg Fellows program, and that falls within education. But before we jump there, just really quickly, all of our research projects happen within a year. They don't go any longer than that, and they're all action-oriented, meaning that there's a product that's developed at the end, not a paper, but something like a toolkit, a program, or a policy that can be transferred from one community to the next. And within practice, that's where those 25 endowed professors, like Dr. Tamar Mendelson, who's with us today, will provide opportunities through connections to organizations, supporting fellows, developing new courses that are applicable to the work and the experiences that you all are having on the ground. Also within practice, we have our public sector consultations where our faculty here at the school are supporting and working with elected leaders and state and local agencies on problems and issues that those communities have developed or are actually identified. So let's jump into education, though, and that's where we can dive deeper into the Bloomberg Fellows program. So we really aren't your traditional scholarship program. The Bloomberg Fellows program, like all the work we do here at the initiative, is impact-based. And we're working with those of you who are on the front lines in your communities, working on these 5 focus areas. And those of you who are on the call today are in likely are working within the adolescent health realm. The studies of the fellows are focused on that focus area, meaning that if you apply into the fellowship program as a adolescent health fellow, that will inform the coursework that you'll be taking. Now, not all of it will be informed by that, however. So you'll have a lot of opportunities to take general public health courses as well as courses from other focus areas. But we will have a series of courses that you would take as an adolescent health fellow. Now, we do have a requirement that all of our fellows serve at least 1 year within their home organization after they graduate. Our hope is that you have the commitment and intention to serve many more years, but we do have that 1-year service requirement. And we also have the home organization's ability. We call the home organization the collaborating organization. They have the opportunity to join this national network of practice of organizations across the country who have the ability to partner and pair up with faculty on research and with each other on particular issues in their organization or their community. The national network of organizations is really a broad view of different types of groups, certainly public health agencies, but a lot of grassroots organizations, non-traditional public health organizations like police departments, schools, libraries. We have a number of organizations through planning departments. We're really looking to find those of you who are maybe not in the traditional public health field, but through the lens and through the skills of public health could further your work. And as we mentioned earlier, we are in providing 50 MPH Bloomberg Fellows, and once we're fully implemented, we can provide up to 10 DRPH Fellows. So here's just a snapshot of what our current fellows program looks like. We have 95 fellows. In 3 years, we've been able to grow up to 95 fellows, and we're very excited. We've had 6 graduates. One of them you'll hear from today. And we are located in 31 states, the District of Columbia, and the Mariana Islands. So all of the U.S. based states and territories are eligible to apply and join the network. And you can see just, again, a snapshot of some of the organizations who are a part of the initiative. We have large federal agencies and small grassroots organizations and truly everything in between. So we are excited now to turn over the mic and invite in Dr. Tamar Mendelsohn, who is one of our Bloomberg American Health faculty members who can share more about her amazing work and the great work that she does supporting students.
Hi, everyone. It's great to be able to kind of meet you virtually. So I direct the Center for Adolescent Health, and I also co-lead the Risks to Adolescent Health area of the initiative that you just heard a bit about. I co-lead that with Dr. Kristen Mari, who couldn't be with us today. So I'll tell you a little bit about myself and then some more about the work of the center and this area in the initiative that's focused on adolescent health. So I'm actually a clinical psychologist by training, but then I discovered public health and I came to Hopkins in 2006. And my work is really focused on developing and evaluating interventions that can prevent emotional and behavioral problems for young people and promote school success. And I've been especially interested in mindfulness-based interventions in the school setting. As part of my work with the initiative, I'm excited that I'm currently developing a course that will be offered online that's called Promoting Equity for Adolescents and Emerging Adults, and I'm happy to answer questions about that if folks have any questions. So let me say a little bit about the Center for Adolescent Health and its work in collaboration with the initiative. So the center has been around for over 25 years. We are a prevention research center funded by CDC, Centers for Disease Control and Prevention. And our core mission is really to promote thriving and well-being for urban youth. We're located in Baltimore and we have a particular commitment to Baltimore, but we really envision a future where all youth thrive in Baltimore and beyond. We have long-standing partnerships with youth-serving organizations like the public school system, health department, and also with youth themselves. We have a very active youth advisory board that is deeply involved in shaping the work that we do at all stages. We have about 25 young people. We also have a community advisory board that has a lot of youth-serving organizations and providers that is also deeply involved with the work and with shaping the kinds of projects and impacts that we take on. And we work very closely with the initiative, in particular around addressing the needs of opportunity youth. So opportunity youth is a term that describes young people who are disconnected from school and from the workforce, who are ages 16 to 24. And you saw kind of a little blurb about this on an earlier slide. And we really, we thought a lot about how should we focus ourselves in this risk to adolescent health focal area in the initiative. Adolescence is a developmental period. It's not sort of one outcome. Um, there's tons of different health issues, and we sort of struggled with what should our focus be. And we ended up deciding that opportunity youth is a key public health problem that in many ways has gone unrecognized from a public health perspective. And I had been shocked to learn that 1 in 9 young people currently are disconnected from school and the workforce. And that's probably an undercount considering the ways that we actually measure disconnection. And these young people are at very high risk for negative outcomes across the whole life course. And that includes poverty, incarceration, poor health, and even early death. There's broader societal impacts. So just from a financial perspective, it's been estimated that opportunity youth cost taxpayers about $55 billion per year in lost tax revenue alone. So this is a really, it's a complex problem that has a lot of major impacts on young people and on society more broadly. So our goal in both the center and the initiative is to reduce the number of opportunity youth and to really think about public health strategies for promoting positive connections for young people. And we do that both from a prevention standpoint. So how can we work with schools and with churches and with other youth-serving organizations to promote connection before young people become disconnected, but also how can we re-engage young people who are already disconnected. And I'd be glad to answer more questions about our projects in that area. We have a lot of different projects going on around different aspects of adolescent health, and we love to work with students and fellows. So I'll stop there and glad to take questions.
Wonderful. Thank you so much for sharing. And as a reminder to everyone, there is a chat function within Zoom that we will be taking questions from. So anything you might have just heard or have heard so far that you want to dive deeper into, or anything in particular that you would like Dr. Mendelsohn to further discuss, please do use the chat function. And we will get to those questions very shortly as we wrap up the presentation. Here's another just showcase of a number of fellows that have been a part of or are currently in the fellows program. And what this really allows for you to see is that, first of all, we have fellows all across the country in rural areas, but also urban centers. We have folks like Matthew, who just graduated and is working in more of a clinical setting at the Community Health Center in the Bronx there. But we also have Casey, who is in a grassroots organization that uses soccer to engage refugee youth in Colorado, and Emily, who's a librarian in New Jersey. So you really can see that we have a wonderful diversity in the types of organizations that folks are coming to us from, and really that we are seeking to find ways to support and engage with. And we are lucky and so very thankful to have Mia, who has graduated from the program just a few months ago and is back to work within her organization at the Community Pediatric Programs in the Bronx. And she has agreed to share with us some about her information or some about her experience as a fellow and connect and answer any of your questions. So we'll turn it over to Mia and allow her to share.
Thanks so much, Shane. Hi, everyone. Thank you so much for joining this call, and I'm really excited to be here. I, as Shane mentioned, was a Bloomberg Fellow this past year, 2018 to 2019. I just graduated with my MPH in May, and I moved back to New York City, and I just started work this past month in June, working at community pediatric programs. And it says here, we're a cluster of federally qualified health centers that are located in the South Bronx. We've been in the community for over 30 years now. And I had been with the program for 4 years when I decided to apply to the Bloomberg Fellowship. And I was just so excited to find out about the Bloomberg Fellowship. I thought it was such a wonderful way to link my interests in adolescent health, my prior public health experience, and my desire to learn more, both in an educational setting and also from other peers who were doing this type of work across the country. So I was thrilled to find out about the program and thrilled when I got it. And I was accepted as a full-time fellow. So I'm sure in the Q&A people might have questions about full-time versus part-time. I'm happy to speak more about my experience with that. So in my role, my primary job role when I started at community pediatric programs, I was with the prenatal health team and the mental health team, coordinating a series of initiatives that we ran that were designed to decrease health disparities for the more vulnerable and more medically underserved patients that we were seeing in our clinic. And then as I stayed there for longer, we had a program at our clinic that really began to grow called Terra Firma. And my job role shifted to cover more of that. And I'm gonna tap my boss, who you'll hear from next, Dr. Alan Shapiro, to talk very briefly about the program. And then I'm gonna circle back to how I was able to leverage the Bloomberg Fellowship to really dive deep into the work that I was doing, the work that we were doing with Terra Firma, and to really bring so many resources back to community pediatric programs.
Good afternoon, everyone. Thanks so much for listening in on the call. Thanks, Shane, and everyone else at the Johns Hopkins Bloomberg School of Public Health. We really were thrilled that Mia got the fellowship and was going to really learn so much that she could bring back to our program. So I'll tell you a little bit about who we are, just so you can understand the context that Mia works in. So we are a community health center founded in 1987, really to focus on homeless children living in family shelters. Over time, we grew and eventually developed a community health center in the South Bronx, which has grown exponentially since we started that program in 1993. So it's interesting, the work that we did with the homeless families and homeless street youth, and the work that we're doing today at Terra Firma really came together in a very particular way. So let me explain what I'm talking about. Myself and our psychologists were working on a mobile medical unit with homeless street youth when we met a young boy from Guatemala who was brought onto the mobile unit by his counselor. And this young man needed really a lot of services. He had just lost his psychiatric medications, and he really didn't know how to access any of the care that he was given. He was quite ill, but he had a card from his lawyer, and the lawyer was his pro bono immigration lawyer at Catholic Charities, who we immediately called, and very fortunately was able to have a conversation with him about who this young man was, the fact that he was an unaccompanied immigrant child from Guatemala, and that what were his needs and also what were his rights. And really through a conversation about this in 2013, we began to develop a program called Terra Firma, which became a medical legal partnership for predominantly unaccompanied immigrant children, and a growing number eventually of asylum-seeking families. So we were very lucky that Mia was part of our program already. She had been a global health fellow, and that allowed us to sort of tap into some of her own skills to help us really kind of form Terra Firma in the community health center. So we went from the mobile medical unit where we met the first client, and we brought the program, an integrated medical legal partnership, into our community health center in the Bronx with lawyers, mental health providers, pediatricians, and youth enrichment coordinators all working together to meet the complex needs of the children. And we really needed, more than anyone, someone to help sort of be the gel of all those elements. And that was Mia. And so when Mia eventually told us that she had applied for this program, we could not have been more excited, because we knew that we needed those skills that she was going to learn at the Bloomberg School to help us, to really bring us to a new level. And so what I'll tell you is that Mia, it was a hard year without Mia. I would lie to say that we did not miss Mia incredibly while she was gone. But, since she's come back, she hit the ground running. She took all the skills that she had learned and brought it to a program that she already knew. So, it was it's a very good model, I think, for other groups out there. And now Mia is helping us really grow the program. She is now our program administrator, and also will allow us to bring Terra Firma to become its own nonprofit organization. And Mia will definitely be instrumental in bringing us to that, from sort of being a project into being our own nonprofit organization. So I'm happy to answer tons of questions afterwards, but I think hopefully that gives you a good overview of how we're working with the Bloomberg School of Public Health and with Mia.
Great. And if I could just add a little bit more about sort of what I did at the Bloomberg School of Public Health, I thought it was very valuable for me personally to be on campus. So the fellowship program does a great job of making every single webinar and all of the resources really available to, obviously, to all of the students in the cohort. For me personally, I was able to complete my thesis on a descriptive article about Terra Firma, looking more generally about the medical legal partnership model, working with faculty at the school, faculty in the risks to adolescent health focal area to really kind of develop that. And now I'm able to bring that back and help lead us in disseminating some of that important work through our research strategy. I was also, through the Bloomberg Fellowship, I was able to get the Applied Experience Award, which is going to help continue to help me lead Terra Firma through a comprehensive strategic planning process that we are beginning this year and really kind of continuing to see through. And I was able to take courses in program planning and evaluation, in research methods, policy and advocacy, and of course, many of the courses relevant to adolescent health that we have and will continue to talk about on this webinar. So I just, as Dr. Shapiro mentioned, we both felt it was just an instrumental program, and we're very lucky to be able to tap into that resource and that network, both of faculty like Dr. Mendelson and of fellow students and fellows to really continue to get deeper impact with the work that we do.
Great. Thank you, Mia and Dr. Shapiro. Thank you both so very much for sharing. And I know all of you who are listening are getting such great advice and insight into the experiences of a fellow of an organization, and hearing from the faculty, and are just patiently waiting to type your questions in. And you don't have to wait. You can go right ahead and start typing in and letting us know what those questions are in the chat function, and we will answer those questions in just a few slides as we wrap up. But as Mia mentioned, there are a number of courses that you'll have the opportunity as a Bloomberg Fellow in the adolescent health focus area to take. And here's just really a sample of some of those courses that are provided. And as Dr. Mendelson mentioned, many of them are, or some of them are transitioning into online for those of you who are interested in the online program. But just as an example, Children in Crisis, looking at an assets-based approach to working with youth, health and development, child and adolescent psychopathology, family violence, maternal and child health, legislation and programs are just really a sample of the courses that are available for you as an MPH student in the adolescent health focus area. So to give you a sense of what the program looks like when you're a student, the full-time format is an intense 11-month experience that allows for you to take courses in person here at the Baltimore campus. So you can see that your terms start in the summer and late June, and then starting in first term in September, the courses are 8 weeks long and will continue to be that over your term as a student. And in May, you would finish up with all of your coursework, your practicum, and your capstone and graduate and go back to your home organization and continue that work. Now, the online part-time format is a little bit different. This will be completed in 2.5 to 3 years, roughly speaking, and students take on average 1 to 3 courses per term. Now, the terms are still 8 weeks long. We have over 300, many over 300 now, course options for you to take. And there are opportunities for you to come here in person to the Baltimore campus and take classes during our institutes, the winter and summer institutes. This provides students the opportunity to complete a course in 1 or 2 weeks and get all their credits for that course and have that didactical learning with other students and faculty in the classroom. It's very popular. Many of our fellows greatly appreciate and take advantage of that opportunity. Partnerships is a very important component to the work that we're doing here at the initiative. So as Mia mentioned, she applied and was awarded the Applied Experience Award, which allows for fellows in collaboration with their organization to do projects that maybe have been sitting on the back shelf or is a new or recent need within the organization. Some examples include a data assessment project, understanding the vulnerabilities of Latino youth, developing a PSA, a video address for the intersections of racism and gender-based violence, and working on an assessment project of obesity rates around food outlets, particularly around churches in the Bronx through a spatial mapping. Again, these are just really a few examples, but the Applied Experience Award is another way to give students, the fellows, an opportunity to apply their learning from the classroom into a project that the organization and the fellow has identified as a good need, a good project that can fulfill a need. And those are up to $3,500. Now, there's other opportunities for your organizations, for the collaborating organizations to be a part of the network. So they can share or have access to best practices. We've mentioned policy changes. So if their organization is looking to adjust some of the policies that inform the way they do their work, we have faculty and practitioners who are able to provide that guidance. Data is always a big ask and something that we all are working with. And so making sure that the data is both rich in that way we are collecting data that allows us to use the data to inform our policies and programs. But also we have so much data, what can we do to analyze it and read into the work that's happening? Research opportunities of the faculty. So as we mentioned, all of our research is impact-based and action-oriented, meaning that you have the opportunity, organizations have the opportunity to connect and collaborate with faculty in these 5 areas. And we have some of the best and brightest faculty here at the school, and there are a lot of different ways that faculty can connect and support work happening at the organization in your community. So we continue to develop new courses, and we'll do so based upon the feedback that we receive from you all as fellows and from your organization about the needs that are in your community. We also have a series of seminars that provide learning for the fellows, but also for anyone in the organization. So your peers and colleagues have the opportunity to either participate in person here in Baltimore or through a simulcast webcast of the seminars. And these are just a few of the topics: performance management, leadership, communication and media training, and many others are provided throughout the year through our seminar series. So the important component, you all logged in today to learn how can you apply, because I know everyone who's on right now is patiently waiting to submit their application. But you don't have to wait anymore. So the application is now available. We are happy to share that it is up on our website at americanhealth.jhu.edu/fellowship. So you can go there and download the Fellows Program application. Now, it's important to know that it is a parallel application with the MPH program. So students do need to go online and complete and submit the School of Public Health application through the SOFIS website. That's going to be available online through the MPH program as well. It's important to review those requirements under the admissions tab. And if you have any questions, to reach out to the MPH office. They are very helpful and are more than willing to guide students in any of the questions for the MPH admissions process. But as you're filling out the MPH program application, you can be working on your Fellows Program application, and it is 2 parts. One will be completed by the student applicant. By those of you who are on the webinar today, you'll answer a few questions to allow the review committee to better know and understand where you're coming from and why you're interested in the Fellows Program. The second part is completed by a representative from your organization. It could be your supervisor, it could be the executive director, the CEO, whomever can complete that portion of the application that allows for the selection committee to better understand the work that the organization does, your work as an employee or a member of that organization, and how joining this network will be able to impact their work. So again, that application, the Fellows Program application, is available online. You can go and download that and begin working on it this evening when you get back to your homes. Or if you have any questions on the fellowship program or the application for the fellowship program, you can also reach out and let us know. So a few key takeaways, and then we're going to jump to the questions that you all, I'm sure, are typing into the chat function because you have a few questions. I just know it. But a few key takeaways. The work that we are doing here at the initiative is impact-based, regardless if it's in the education in the Bloomberg Fellows program or the research or practice focus of the program. A very critical component to the Bloomberg American Health Initiative is training the future leaders of public health to use the tools of this field to improve the health of your community. And the Bloomberg Fellows play an incredibly vital role in making that change. They are the link to the collaborating organizations, and they will bring those opportunities back to their community that will truly make a difference. And so we are excited to have you all on the webinar today and watching the recording who are going to be helping us do just that. We want you to stay connected to us. So our website, you can follow us on Twitter at American Health. We have a wonderful newsletter that comes out every Friday, the American Health Dispatch. It strongly suggests folks register for that to follow the current trends within the 5 focus areas. We have a podcast that dives deeper into issues that impact public health across the country. And we have a YouTube channel that has many great resources, trainings, and videos that you might enjoy to see, or your colleagues and peers could enjoy by subscribing to that as well. So our contact information, myself as a Partnership and Engagement Officer, my colleague Faria, who's not able to join us today, but can answer many or all of your questions for those of you who have any questions about the application or the Fellows Program. Our email addresses are listed here. The internet or the website for the Bloomberg American Health Initiative is down at the bottom. And we are ready to start taking a few of your questions. So that's the end of the formal presentation. Again, the chat function you can find if you hover over the presentation. You'll see a chat function that you can click and it will open a new screen and you can type in your questions into the chat function there. To get us started, I did have a few questions emailed in for folks who weren't able to join the live presentation. And so I can share them with the panelists and see if we can get a few of those answered. So here's the first question. Their organization has questions about being a part of the initiative. what should they tell them to calm their nerves? So that's a pretty common question that we get, and folks are often asking, "What's the catch?" And we don't have one. We're fully funding a member of your team, you as an applicant or another employee within the organization, to participate in this fellowship program. For the MPH students, we also provide a $10,000 stipend that can be used for anything, new computer, for books, for travel. We ask no questions, but it's just another way that we want to support the students. There's no buy-in from the organization. The only thing we do ask is that the organization supports you as a student and can commit to keeping you on the team for at least a year after you graduate. Now, that's not a legal requirement, and we can't force an organization to do that. We certainly understand things can come up, but we do ask for them to make that commitment in ensuring that you are successful as a student and that they will continue to be a part of this work well after you graduate. Another question that we have is the difference between the full-time and the part-time program. So Mia, if you're still with us, this could be one that maybe you can shine some light on. So this individual is currently working full-time. However, they would like to participate in the Bloomberg Fellows on a full-time basis to complete in the 1-year, 11-month term. Their question for you, Mia, is how have the fellows been able to stay connected with the organization while they are away in the academic program?
Hi, can you hear me?
Yep.
Okay, great. That's a really great question, and that's something that I think I was concerned about as well. One thing to note is that the fellowship makes it very easy to do this because all of our academic requirements, so the capstone, practicum, and if we get an applied experience award, are required to be in connection with our collaborating organization. So Dr. Shapiro was my preceptor for my capstone project. He was a primary advisor and reader on my capstone, and also gave me advice and counsel on the Applied Experience Award. So in that way, there are those sort of formal mechanisms that you continue to be in touch with your community organization, their collaborating organization throughout the year. And then personally, I tried to schedule in-person check-ins when I could. I know that's not feasible depending where people are coming from. I was fortunate to be in New York, have my program be in New York while I was in Baltimore, so it wasn't too hard to get there if we had a big meeting that my attendance was required at, or if I wanted to visit and set up some in-person interviews or meetings. So I did that as well. But really my main answer would be that the fellowship actually makes it quite easy to stay connected with your collaborating organization. And the last thing I'll mention is that the summit, the Bloomberg Summit, which happens every year in the fall, was a chance that my collaborating organization and myself and all the other fellows could come together and meet in person and hear from other people's programs and really develop some stronger connections there as well.
Great, thank you so much for sharing. And another distinction I would say between the full-time and the part-time program is, as a full-time student, you are the coursework is pretty heavy. You are completing in 11 months, and there's not a ton of opportunities for the fellows to be physically present or be working on projects within that organization. But conversely, with those of you who are maybe at an organization that doesn't have the capacity for you to be gone for 11 months, the part-time program is likely a good fit for you. And I will say, of the 50 students that we brought on this June to join the fellowship program, 45 of those individuals are completing the fellowship program on a part-time basis, which allows for them to continue their work full-time. And often a question we get from folks after sharing that is, how are they balancing their coursework, their schoolwork, their life, and all the other things that that's thrown at them? And what I would say is we have a great webinar that we did a few weeks ago with one of our part-time fellows who is a new parent, who was working full-time and got promoted to a new role, and truly was excelling as a fellow as well. So it's really about the flexibility within the part-time program allows for students to adjust the number of courses they're taking. Participating in the institutes allows for you to take a week away from work, which maybe is difficult, certainly, but allows for you to get a number of credits and courses completed in person with other folks working together. And then another great component of the Bloomberg Fellows program is we offer academic support. So without any questions being asked, the fellows can let us know at the initiative team that they would like some extra support, and we will find a tutor that is well qualified, meaning that they have taken this course before from this faculty member in either the part-time or full-time format. And we pay that tutor so they are accountable, and we've gotten really great reviews from the fellows about that particular support. What we really greatly value here at the initiative is for our fellows to be successful, and we want to make sure that they are successful regardless of full-time, part-time, or how many courses they're taking. All right, Eddie, so we have a question from the chat function. If you are put out of your current job for some reason, nonprofits doesn't get the grant renewed as an example, what would you be obligated to repay for the fellowship and stipend? If not, what would constitute having to repay? So great question, Eddie. So first and foremost, we certainly understand that there will be situations that will arise that for a variety of reasons, a position is no longer available or a fellow has to move on from that organization. And currently, because we are such a new initiative, we view those cases on a case-by-case basis. We are not going to punish the fellow for something that is out of their hands. So you will not have to repay your loan. We will support you in finding new employment and a good fit for the work that you're doing. The only time you would have to repay the fellowship program is, let's say you graduate, you are an adolescent health fellow, and 2 months after graduating, you decide to become a VP at a bank. And we really would have a hard time making that connection to the work that you're doing and has it related to the fellowship program. So the repayment of the loan would be standard with a federal subsidized loan, and the repayment would kick in that way. But as long as it isn't that type of a scenario, we don't foresee the fellows having to repay that loan. But good question, and hopefully we answered it. If not, Eddie, please do let us know. Another question that we have here came from an email again. So this one is for Dr. Mendelson. The student says that the applicant says that they currently work in an after-school program that mostly provides academic support to young people. Their goal is to move beyond just the academic support and provide opportunities to support the growth of the young people in their program. Are there opportunities through the Bloomberg Fellows program to learn best practices in supporting or developing new programming to work with at-risk youth? So that's a long question. Hopefully you can shed some light on that.
So the answer is yes. We do a lot of work in intervention development and adaptation. The other thing I would say as well is that the faculty and collaborators that we have are very well versed in existing evidence-based programs. And so, also just being familiar with what kinds of strategies are already out there and are effective. Can we use any of those? Can those be adapted? So I think all of those are sort of options out there, but that is exactly the type of work that we do.
Great, thank you so much. And the last question that I have, unless we get some more questions in from our chat function and from you that are participating in the live version, is I've been out of school for over 10 years and a little anxious about going back. What resources are there for fellows to support us who have been out of school for a while? So first and foremost, let us say that we are looking for those of you who have been out of school for a while. We believe that this fellowship program is a great way to further your work and your commitment to your community and the organization that you're part of. As we mentioned just a minute ago about the tutoring, we also have a professional staff at the initiative that is here to support you as a fellow. You will have a faculty mentor. You will have mentors within the practice office who will support your work as it relates to the practicum and capstone. And I think something that is of great support, and maybe Mia can shine some light in this as well, is your other students that you're working with. Folks are truly coming at the fellowship program with a variety of experiences, and it's great that the fellows have had the opportunity to connect and work together. But Mia, if you have anything else you would like to add about supports or what it's like going back to school after being out for a few years, we'd love to hear that.
Sure. I mean, I was nervous as well, and I think definitely what you spoke to, Shane, about having this resource of other fellows who are going through it at the same time and who might more likely be non-traditional students than sort of the general cohort at the Bloomberg School. I did find that particularly useful. As I already mentioned, since I was one of a few students who were on campus as the full-time cohort, we did rely on each other a lot and kind of banded together, and particularly two other fellows who were also in the risks to adolescent health focus area. We were able to collaborate a lot about courses and material and study together for exams, and that was really valuable as well. But I know that friends of mine who are in the part-time fellowship also really connected online with other fellows through the online courses that are very highly participatory and often have assigned groups with other fellows, and kind of found these venues for support beyond the obvious support that the Bloomberg Fellowship Office really did provide to us, going out of their way to host webinars and seminars, and as Shane already mentioned, provide that academic support as needed. So altogether, it definitely eased my nervousness as I got there and realized how much there was available to us as resources.
Thank you so much for sharing, Mia. A couple of last questions here for us. So one question is talking about if our organization believes they have enough capacity for us to do the full-time program, but later decides that they don't have the capacity. Is it acceptable to change from full-time to part-time? So that's a little bit of a complicated question because the full-time students do have, we pay for their insurance, we are covering a number of their expenses as full-time students. So what I would suggest is if the organization has any concerns at all or would like to discuss further with a member of the initiative team, to reach out to myself or to Faria, and we can set up a time to talk a little bit more about what that year could look like. We do want, our hope is that for those who apply to the full-time program, they can complete that term of academic years in the 11 months. But please do reach out if you have any questions about which one to apply into. And the last question that we have for part-time fellows: what is the average course load and term of study? So it is I would say right now, so first and foremost, we are a very new initiative. So we started in 2016, and of all the graduates that we have, they are all from the full-time program. It currently looks like 2.5 years to 3 years is going to be the norm for the fellows to complete in their part-time function. Certainly, there are special situations where it adjusts a little bit. So if there's a lot that folks have going on professionally or personally, they can take fewer courses and allow for them to have more time to be dealing with whatever else they might have going on. It is typically 2 to 3 courses that students are taking per term. and depending on the ability to come into the institutes, that can lessen the number of courses that they would need to take in order to complete in the 2.5-year time frame. So Mary, great question, and thank you for asking. Again, folks, if you have any additional questions, our contact information is listed here. We will send you a recording of this webinar. We greatly thank you for tuning in and watching the recording, and we are greatly anticipating your fellowship applications. So thank you for logging in. Thank you for joining us, Dr. Mendelson, Mia, and Dr. Shapiro. I hope you all have a wonderful rest of your week, and take care.